Now that Roe v. Wade has been overturned, what does that mean for your reproductive health? I'm Dr. Natalie Crawford. I'm a board certified OBGYN and REI, and today I want to talk about what does it mean now that Roe is overturned to live in a post-Roe world. This is a really hard question, and it's a really scary time for those of us who have dedicated our lives to caring for people, because suddenly we're put in a position where potentially we're not able to act in the best of our medical judgment due to laws or politics. Now, most physicians I know are, of course, trying to do everything they can to care for patients, but sometimes the system truly won't allow it, meaning your hospital has to allow patients to go to the OR. You need pharmacists to dispense medications. Health is not just linear, it's really complex. So, I want you to understand the repercussions and what this all means so that you can understand this issue the best. When Roe v. Wade was passed, it really protected this spectrum of reproductive rights, really solidifying that you can have contraception, emergency contraception, access to abortion, proper treatment of miscarriage and ectopic nonviable pregnancies, and access to infertility care. As you know, I've said before, I'm an IVF doctor, and IVF exists because of the protection of Roe. Because if you're allowed to put your own body and life first, you're allowed to make decisions about your reproductive health. And if an embryo at fertilization is a person, it makes doing things like growing them in culture, biopsying them, freezing them, transferring them, discarding them much more difficult. So IVF exists because Roe gave us freedom to explore technology to help people have families. And that's what I dedicate my career to. But let's break down what this means living in a post-Roe world. The thing that it means really transparently is that in certain states, you're not able to get an abortion. We have to remember that abortion is a multifaceted term, meaning you can get an abortion because you don't want to be pregnant, you can't be pregnant, medically it's dangerous for you to be pregnant because of birth defects of the baby, a genetic disease, the baby won't survive. There are so many different reasons. And I see patients all the time who get abortions who desperately wanted to be pregnant. And the reason why is that pregnancy is not a health neutral state. We must understand that one of the top killers of women used to be getting pregnant. Now, other things like car accidents and cancer are higher killers than pregnancy, although we still live in a country with a really high maternal morbidity and mortality rate, and that's only going to get higher, meaning it's already dangerous to be pregnant in the United States, and this is going to make it worse. We were always taught in school that you need to protect the life of the mother. And because even in somebody who's healthy and a pregnancy that seems to be fine and normal, there's a risk of dying in giving birth. It's not a health neutral state. And I believe that somebody has the right to decide if that's the right thing for them or not. However, whatever we want to look at it, abortion is going to be limited. It's already limited in some states like mine in Texas. Right now, if you need a termination, you're able to travel to other states. And if you're still early in your pregnancy, you can order pills for medical termination. What are we afraid of? One, we may see laws that limit getting medications for medical abortion in certain states that outlaw it. And we potentially could see limitations on travel if you're pregnant. This seems like such a huge invasion of personal rights. It's truly hard to fathom somebody checking to see if you're leaving the state and if you're pregnant or not. But we're honestly fearful that some states could get this way. As far as medical abortion pills, misoprostol, mifepristone, these medications can be used if you're very early on. I recommend you go to Dr. Jen Lincoln's website, which she's created called 3 for Freedom. Her site is helping people get access to contraception, emergency contraception, and medical abortion pills. I encourage you to go check it out so that you can be prepared. Potentially, if you're in a position where you're not ready to be pregnant, it might be smart to order some of these medications and have them on hand for you. Same thing with emergency contraception. So medical abortion pills are more effective the earlier you are. So if you are less than 8 weeks pregnant, they are very effective in helping you in the pregnancy about 95% of the time. So that's medical abortion. Okay. If you're further along, there's a greater chance that you would need surgical intervention. And obviously, sometimes people get terminations because something happens later in pregnancy. It's not that they know about it at 6 weeks, but just so that you know, that's something to be aware of. So abortion in certain states, definitely going to be limited. There's also emergency contraception. So emergency contraception is not an abortifacient, meaning it does not cause an abortion. However, it can prevent fertilization or implantation of an embryo. And so that can help you prevent a pregnancy. The best options for emergency contraception, number one, is a copper IUD. You could actually go to your OBGYN, get a copper, a non-hormonal IUD placed within 5 days of unprotected intercourse. So you can go in, get a copper IUD, done. The second is Plan B and Ella. Those medications prohibits fertilization, number one. It also impacts implantation secondarily. So again, neither of these cause an abortion, but they can prevent pregnancy from happening. Now, another option is called the ESP method. This is like old school. I remember everybody talking about this in college, but this is birth control pills. So your regular birth control pills that you have, you are going to take them out and you're going to take some of the active pills. So remember, the active pills are usually the colored pills in a pack if you have both. Those pills have both estrogen and progesterone in them, and so you can take them both. Okay, so the ESP method is named after somebody who created it or kind of came up with it. It's using combination birth control pills to get a high enough progesterone level to do the same thing, prevent fertilization and implantation. Now, the important thing is that in modern medicine, different birth control pills have different strengths. So you need to take 2 different doses 12 hours apart, but what you need to take is 0.1 milligrams of ethinyl estradiol, that's the estrogen component in a pill, and you need at least 0.5 milligrams of levonorgestrel or 1 milligram of norgestrel. So depending on the type of pill that you have, you need to take up to that dose. So we'll look at mine, for example. So my pill has 0.02 milligrams of ethinyl estradiol in it. That's a low dose estrogen pill that's more common now. And so in order to get to 0.1, I'm gonna have to take 5 of these active pills and then 5 again in 12 hours. Okay. Now, the other thing to know is that that can make you really nauseous. And so if you have Zofran or Phenergan, it is recommended to consider taking it with an anti-nausea medication because it can make you nauseous. So right away, we're going to have limiting access to abortion. This is going to make it harder to get termination if you need or want one. We're going to see difficulty accessing medical abortion, which is typically very safe and effective. So you might consider getting that to have on hand. And then we're going to see potentially in difficulty getting emergency contraception, because what we are seeing is that people, politicians, not doctors, who are interpreting the law are interpreting this differently. And so there are talks about limiting some of these contraceptive methods. So you need to understand, have a plan for what type of emergency contraception you can use if you find yourself in a position where you could need it. Copper IUD, high dose progesterone like Plan B, or even considering your oral contraceptive pills at really high doses like the ESP method. Some other things I want you to think about. Well, we could be seeing future rulings that could make it illegal to access contraception or contraception not a right for everybody. Did you know that contraception initially was only granted as a right for married people? So that if you were single, in my mind, my gosh, when I was single, that's when I really needed contraception. You might not be granted the ability to have that as a right because they don't want to encourage promiscuity. Okay, and we've seen that hinted at, that the contraceptive decisions might be on the table as next things that are not included in the Constitution. I think that's an extremely personal right. Birth control and an IUD have given me the ability to space my family, achieve my career, and not have to have a pregnancy at a time when I wasn't ready to become a mom. We're also seeing right now in this country management of non-viable pregnancies or life-threatening situations being really dangerous for people. And the reason why is that some of these states have life of the mother clause. That makes you feel good. Like if she's dying, you can save her. However, what we're finding out is that somebody comes into the emergency room with an ectopic pregnancy. It could be in your fallopian tube with a heartbeat and your tube could be ruptured. You could be bleeding into your belly. However, you're still hemodynamically stable, meaning your blood pressure is still okay, you're young and healthy, your heart rate's still okay, you're still perfusing your vital organs. In theory, that baby still has a heartbeat, even though it's totally non-viable. It's in a tube that is ruptured. Now, what some hospitals are doing is their legal team is getting involved and saying you cannot take that person to the operating room until they have a drop in their vital signs, until they become what we call hemodynamically unstable, meaning at risk of death, hemorrhagic shock, to the point where they need blood transfusions. They're risking huge scar tissue. Their surgery is going to be harder. Their recovery is going to be longer. And then what about the setting where potentially we find an ectopic pregnancy and you could take methotrexate and not need surgery? Or you could need surgery to take out one tube but leave the other and not have to be close to death in order to do so. These are life threatening situations and not resulting in a viable pregnancy. There's no way. Right now, we are seeing people be impacted by this. We're also really concerned about miscarriage management, for incomplete miscarriage, for people specifically in some of the situations that you don't always think about, like molar pregnancies, where you have a baby and then a mole, which can be really dangerous to mom's life. Those can coexist together. You can have twin pregnancies where one of them is causing, acute hemorrhage and you need to save the life of the mother. And you might have to in the life of a baby in order to do that. That's terrible. Nobody wants to live through those scenarios. Those are heartbreaking moments for physicians. And I've had one when I cared for a patient who had a twin pregnancy, had a molar pregnancy that was causing her to have something called thyroid storm and high blood pressure so high that she was at risk to have a stroke. And we had to end her pregnancy in order to save her life. There was no denying there was nothing else to do. But these are medically complex, hard decisions that we don't always have time to consult the legal team in making them. And what is going to happen, uncertainty in these states is going to lead to delay in care. And delay in care is going to lead to people dying or becoming much sicker and having other long-term outcomes than we would need to have. We're also fearful of people not seeking medical care even when they should. If you try an at-home abortion and it doesn't work, that you're going to be fearful to get medical care. We're worried about people seeking like herbal treatments and things that really can cause like liver failure and kidney damage, and they're not safe abortion methods. There's traumatic abortions. Women used to die from self-induced or unsafe abortions, and we're so fearful of that. So the advice I have is that there are safe ways to have an abortion. The best thing to do is to try to get medical abortion pills if you can have them on hand, have a plan to travel somewhere if you need to. I understand that's not accessible for everybody. However, if you're having a pregnancy complication, if you are bleeding or have a fever and you're pregnant and you're bleeding, regardless of if you took abortion pills or herbs or whatever, please seek medical care. If you live in a state where abortion is illegal, you don't have to tell them you had an abortion or that you tried to have an abortion or that you went out of state for an abortion. You can just say you're pregnant and bleeding. There's no test for me to know if you took misoprostol or not. It doesn't matter at that moment. At that moment, we need to save your life. So we're very fearful that we're going to have more people not seek medical care for fear of legal prosecution, and then they're not going to get care that could save their life. Pregnancy should not be a lethal state in the first trimester, and I'm afraid we're going to take it back to that in many circumstances. The other thing I want to touch on is that we are fearful in some states that these laws could prohibit the ability to access safe and effective IVF care. When it comes to IVF, because IVF came to light in this post-Roe world, Roe allowed us to do IVF and advance our technology. We are able now to do things, stimulate women with more medications to get more eggs per cycle. That allows you to more effectively, efficiently, and with less money go through a treatment cycle. IVF is already very expensive. It also allows us to do genetic testing of the embryo, to pick the best embryo, to only transfer one at a time, to get you the highest rate of live birth and the lowest rate of complications. And if we roll the clock back to how it used to be, or to what we do see in some countries with IVF restrictions, a limitation on how many eggs you can fertilize, forced transfer of all embryos that make it through, inability to freeze embryos, inability to do genetic testing, IVF will become less accessible, less successful, less effective, and more expensive in these states. This is also, all of this together, going to lead to care deserts, meaning IVF doctors, embryology labs, high-risk OBGYNs fresh out of training aren't going to come to these states and practice unsafely. So then people who live in a state who deserve a high-risk OBGYN doctor to manage their preeclampsia, who deserve an IVF doctor to help them go through IVF because both partners carry the same lethal genetic disease. People who need just a regular OBGYN to manage their pregnancy or a gynecologist to do their hysterectomy. There's going to be less providers for women's health in these states if this persists. Doctors prosecuted, nurses, patients, whatever the state and the situation may be. And when the stakes are very high, felony charges, years in prison, this is out of proportion to what doctors went into medicine to do, to take care of people. And so now you're asking them to live in a state and do it unsafely, or potentially move to a state where they can practice without fear of their life or their license. These are terrible decisions. We should all be livid about this. If you have anybody in your life with a uterus, a daughter, a sister, a mom, an aunt, a friend, a colleague, anybody who has a uterus, you should be livid about the current state of reproductive health. Abortion access is the tip of one iceberg. It also includes proper management of pregnancies, contraceptive access, and fertility care. And we need to understand what all of this means. I beg you to get involved with us. You can check out a new organization, a nonprofit called Doctors for Fertility. This is people all over the country coming together because we think reproductive rights are human rights. We would love to have your support. As always, you can listen to the As Women podcast for more information or follow along on Instagram at Natalie Crawford MD. Thanks, friends.